A blessed day, everyone. I am Kate Tavera, and for today, I'm about to report the first aid and emergency care speech, the best practices of first aid in this time of pandemic. For the outline of my speech, I will cover the how does COVID-19 spread, first aid CPR, AED, or care during COVID-19, general guidance for preventing COVID-19 transmission during CPR and first aid, guidance for comprehension, guidance for AED application and use, guidance for cleaning and disinfection after first aid care, and of course for the references. So how does COVID-19 spread? COVID-19 is a coronavirus that is closely linked to the severe acute respiratory syndrome or SARS and Middle East respiratory syndrome coronavirus or MERS viruses. It is spread by inhaling minute respiratory droplets from an infected individual. Sneezing, coughing, and even talking are common ways for an infected person or symptomatic or asymptomatic to create these little droplets. Those who are less than 1 meter away from an infected individual are at a greater risk of inhaling virus particles from that person. Larger respiratory droplets from mild coughing and talking only stay in the air for a short time and rarely travel more than 1 meter. COVID-19 is most likely transmitted by respiratory droplets. According to existing findings, while symptomatic patients who sneeze, which is less prevalent in COVID-19 than flu, can propel particles considerably further. As a result, the risk of infection is much higher inside enclosed environments than outside. First aid CPR or AED care during COVID-19. First aiders assisting people with possible COVID-19 should inquire and assess whether the person has traveled in the last 14 days and or if they have experienced any of the following symptoms: cough, fever, symptoms of the flu, and breathing problems. If they confirm it, proceed to the next step in assisting someone who is suspected of having COVID-19 before providing assistance to another person. What should you do if you are called upon to assist someone who is ill and has been diagnosed with COVID-19? When assisting someone who has been diagnosed with COVID-19, make sure you are wearing a pair of disposable gloves and mask. Before putting on and removing all PPE, wash your hands well with soap and water or use alcohol gel if hand washing facilities are not available. Direct the individual to a location away from other people. This should be done in a separate room, or if that isn't possible, ask others who aren't offering assistance to stay at least 2 meters away from the person. Avoid making physical or personal contact with the person. If the person is coughing or sneezing, make sure they have tissues to cover their mouth and nose. Wash your hands thoroughly with soap and water as soon as possible after assisting the individual. If soap and water are not accessible, alcohol hand gel is advised. If you haven't washed your hands, don't touch your eyes, lips, and nose. Let's talk about the general guidance for preventing COVID-19 transmission during CPR and first aid. While no specific data on COVID-19 transmission during CPR or first aid is currently available, it is reasonable to assume that chest comprehensions have the potential to generate respiratory droplets or aerosols, and that close contact required for some aspects of first aid may pose a risk of transmission. So let's now talk about the guidance for compressions. Every cardiac arrest victim should receive chest compressions, and if an AED or automated external defibrillator is available, utilize it. Whether or not COVID-19 is suspected in a cardiac arrest victim, 911 should be dialed, and if an AED use is accessible. The essential steps in performing hands-only CPR. First, Kneel beside the person and place the heel of one hand on the center of the chest. Second, place the heel of the other hand on top of the first and interlock fingers, keeping both arms straight with shoulders above the hands. Third, perform chest compressions by pushing hard and fast, at least 2 inches deep. Fourth, do at least 100 to 120 pushes per minute. Fifth, keep doing this until you see the signs of life like breathing or until paramedics arrive at the scene. Now, the guidance for AED or automated external defibrillator application in this. Defibrillation has not been demonstrated to produce respiratory droplets or aerosols in trials so far, and it is well recognized that rapid use of AEDs saves the lives of cardiac arrest victims. Furthermore, existing methods of automatic external defibrillation rely on adhesive pads to provide hands-free defibrillation without direct touch with the sufferer. Guidance for cleaning and disinfection after first aid care. Clean and disinfect things that came into contact with the victim while wearing personal protective equipment. Discard your personal protective equipment and practice hand hygiene after cleaning. Prior to disinfection, all surfaces should be cleansed with soap and water. Here are the references that I used for this report. I really appreciated that you took time to listen to my presentation. Always keep safe. Questions or feedbacks, feel free to ask me on my social media accounts. Thank you.